What's up, fam? It's your boy called Dimma, and this is the Oral Health Bar Talk. This week, we'll be talking about puberty and its effects on your dental health. So, as always, two articles, kids. So, the first article I've got here is from the Canadian Bay Dental, and it was published in 2015. Okay, so the article's name is The Impact of Puberty on Dental Health. So it's got a bit of some headings here, so let's go through all the headings and see what we can tell you. Hormone changes in puberty. Girls in particular can experience an increase of certain types of dental issues as the hormone balance in the body begins to shift. The onset of menstruation brings with it an increase of certain types of hormones that can encourage the growth of certain bacteria. Many girls and some boys in puberty will experience symptoms of gingival bleeding and gum sensitivity. So, as I talked about in the women podcast, there's a hormonal imbalance with women and girls and females in general, and that also can happen in puberty. So it can affect some boys too. So this hormone imbalance actually can cause a exaggerated response to inflammation, so an inflammatory response that is exaggerated. So there might be small amounts of bacteria or a causative agent, but then there might be a lot of inflammation, a lot of swelling and bleeding and tender gums and all of that. So next we go on to risk of more serious dental conditions. So gingivitis, if left unchecked, can progress into the more serious gum infection called periodontitis or periodontal disease. In periodontal disease, the infection goes deep into the tooth, the gums, and the bones. Yeah, we all know this. Again, it can be diagnosed and treated effectively if it's caught early. So yeah, basically they're just saying that there's more risk of periodontal disease or gingival disease, or gum disease in simpler terms, for the reasons that I have actually stated before. So also orthodontic concerns in puberty. As children develop and their adult teeth begin to grow in, they can experience changes in the shape of their bite and the appearance of their mouth. By the time they begin puberty, most of their adult teeth have already come in, at least the ones in the front of their mouth that are visible to other people. If it has been determined that their teeth are not in properly or some problem with the shape of the child's bite, then this is the time that orthodontic treatment could typically begin. So orthodontic treatment, for anyone who doesn't know what that is, it's basically braces. So obviously it's not only braces, but it's basically when you've got to go to the dentist and orthodontist and they're trying to fix the alignment of your teeth and your bite. So they want you to have proper occlusion, which is the way your upper teeth and your lower teeth meet. So some people have an open bite, some people have a cross bite. You hear people get made fun of a lot for those things. But obviously in puberty, as a teenager going through puberty, it can be very stressful as you're trying to fit in and you're trying not to look like a weirdo or whatever. So this can bring a lot of stress for a teenager in puberty. So that's why it's important for people to get their occlusion checked out or taken care of at the stage. But not just that, that's not like the most important part. It's because as you're young, as a teenager, the bone allows for that treatment to take place faster and in a more efficient manner than when you get older and the bone kind of just doesn't cooperate anymore as much as it used to as when you were young. So it's important for you to get that orthodontic treatment done as young as possible. But I know at this stage most teenagers are worried about are their teeth straight, clean or whatnot. So that's why orthodontic treatment is also one of the things people are concerned about at the stage of puberty. managing the overall impact of the puberty on dental health. So perhaps most difficult is to quantify this emotional impact of puberty on behavior of adolescents. Many kids become very self-conscious of themselves during this dynamic period of time, and they can experience increased peer pressure to engage in behaviors. So let me stop there. So basically what they're trying to say is that as you go into puberty, you might get into some habits that you're not supposed to, maybe sexual habits, smoking, alcoholism, and all those things also have an effect on your general oral health. So what it does to your oral health is like for smoking and alcohol, you get increased susceptibility to certain diseases, to certain gum disease and all of that. And you also get from sexual contact, you might get certain manifestations in the oral cavity like sores and all of that. So it's important for you to as a person going through puberty, it's important to you to make sure you know where you are psychologically, and to make sure you're taking care of your dental health at the same time. And let's just check what else they have on this article. So that's basically the main thing they speak about in this article. So let's go to the Colgate article that we always have. Here it is. It says oral health in children as they become teenagers. So basically, they first of all, they have contributing factors to certain things. So they have dietary habits. So as you become a teenager, you go through puberty. Obviously, especially for the boys, your feeding becomes a bit more erratic and weird. So you eating unhealthy stuff. You're having Cheetos with I don't know, with muffins and stuff that's just your diet. And for diet, for that type of diet is usually carcinogenic. So carcinogenic meaning it can lead to dental cavities. So that's one of the manifestations that you can have, which is a contributing factor to disease. So also you've got traumatic injuries that can occur at sporting activities can contribute to dental and facial injuries. These injuries are primarily caused by falls, collisions, contact and hard surfaces. So obviously as you get to this age, you're playing sports, you're trying to impress that girl, that cheerleader or whoever it is you're trying to impress, and bam, you get knocked in the face with the hockey puck, or you get knocked over by some big oak who runs you over in a rugby game or whatever, and then obviously your tooth fall out, and you get dental injuries, so you're more susceptible to that. So get yourself a mouth guard, get yourself a gum guard from your nearest oral hygienist. So obviously it talks about oral piercings. So the piercings you might have, as a teenager, you're trying to look all trendy or gothy or emo or whatever. Yeah, so that's when there's the podcast I did on piercings. You can go check it out on the YouTube channel or the website, and there's a more in-depth analysis of oral piercings. So next of all, you have smoking and alcohol. 88% of youths take up cigarette smoking by the age of 18. Wow. 99% start smoking by the age of 26. Smoking and other forms of tobacco use, such as smokeless tobacco, are usually associated with oral cancer, cancers of the head and neck. There's an increased chance of developing cancer of the mouth with tobacco usage. Excessive consumption of alcohol and overexposure to the sun. Unfavorable dental outcomes are linked with smokeless tobacco, such as gingival recession and periodontal disease. Cancer. So think about that before you smoke. I'm just saying. Next, we have tooth whitening and stain removal, obviously for aesthetical reasons, as we were talking about with the orthodontic treatment and the braces and alignments. You want to look good, you want to look hot, you want to look like Bay. And then we got eating disorders. Obviously, as a teen, you have anorexia and bulimia as a problem that might be shadowing you as a teenager because of bullying and trying to fit into some whatever fake stereotypes of what a person should really look like. And that excess vomiting and all of that, it leads to your teeth to become green and eroded because there's acids in your vomit, and that is really affecting your teeth. Not only your teeth, also the soft structures in your mouth, like your tongue, your roof of your tongue, the inside of your cheek. It might cause scarring and ulcers. So think about that before you take part in anorexic or bulimic practices. I know it's difficult. You need to get some counseling for that and make sure you get the help you need, because it's also affecting your appearance. So yeah, don't listen to that. Just be you. Love the way you are. And that's just all I can say about that. And then next we have tooth crowding. Obviously, crooked teeth. I grew up with crooked teeth. I was bullied, blah, blah, blah. Life moves on. But obviously, if you want to look good, if you have the money to, you have the opportunity to, you should go get your braces. Make sure everything is A-okay with your mouth. And yeah, so that's what they say in this article from Colgate. So what is my advice for you and the teens out there going through puberty and their oral health? Listen to your mothers, listen to your fathers, even if they're nagging you. Brush your teeth twice a day, when you wake up, after your breakfast, and just before you sleep. Come on, keep it clean. And if there's issues with crowding, if there's issues with how your teeth look, you don't like how your teeth look, even issues with your body, if you don't like how your body looks, I mean, just talk to someone much older than you, and they might be able to guide you in a way that's healthy for you, so that you can stay away from eating disorders and stuff like that, because it really doesn't help. I'm just gonna tangent a bit about eating disorders a bit, because I feel very passionate about this. Is you just need to be who you are, and there's always someone for someone out there, and you might be surprised at what a boy really wants in you. They don't want whatever it is you're looking for when you go down the eating disorder path. And it's not always about a boy. Sometimes you just don't feel good about yourself, or there's some underlying stress or depression going on. Go see someone. Talk to someone, your guidance counselor, any counselor. Just talk to someone, and yeah, they'll lead you in the right direction. And obviously, puberty, teenagehood, high school, things get very difficult, to say the least. But hang in there, kid, and if you have the opportunity, you can fix your teeth, you can fix your mouth, you can make everything look good, but don't make that be your life. Just shine through. And even if it's a crooked smile, as long as it's a clean smile and you have healthy gums, there's nothing for you to worry about in your mouth. Okay? You hear me, kids? That's all you need to know. That's what Uncle Carl says. Okay, Uncle Carl doesn't sound cool. Let's just go back to Carl Dimmadin. So that's it from me from the Oral Health Bar Talk. The topic for next week has not been decided because I have been feeling like a zombie the past few days. But I'll let you know in Instagram what the next topic will be about. So just smile.